It's a pleasure to introduce. Richard McKean is going to offer some introductory and summary remarks this morning. And so, Richard, it's a pleasure to welcome you, and we look forward to hearing what you have to say in terms of shaping this event.
Thank you, David. I'm really pleased to be here, and I thank the staff of the National Academy of Sciences for pulling this together. So let me just make a few comments about why SAMHSA was interested in supporting the organization of an event like this. Obviously, as David has referenced, it comes within the context of significant rises in suicide across the United States. The recent CDC report showed that suicide had increased in 49 of 50 states, and in fact, in half those states, the increase was greater than 30%. So there is clearly for us a need to do more and better, and to not rest on the laurels that we're doing some good programs, but to strive to increase the effectiveness of our suicide prevention efforts and to try to save as many lives as possible. And the issue of the relationship between suicide and serious mental illness is important for a number of reasons. And it would probably be easy to do lengthy academic treatises on these relationships, but that's not really what at least SAMHSA was hoping to get from this. But how you view suicide has some profound implications in a number of different ways. I'm thinking about the fact I just got back from 2 weeks on vacation in Europe, and I was talking to a Dutch colleague who basically talked about one of his colleagues who was grappling with, was treating a 23-year-old young woman who was depressed and suicidal, and was trying to decide whether he had a responsibility to honor her autonomy on that. I think that if you regard suicide as being an existential choice, as opposed to being related to serious mental illness in adults or serious emotional disturbance in youth, you can come to some very different conclusions about what needs to be done. The literature that I'm familiar with suggests that the rates of suicide among those with serious mental illness and serious emotional disturbance are significantly elevated beyond virtually any other group that we often target for intervention. There are also some very practical implications. For example, SAMHSA's mental health block grants, which go to each of the 50 states, are by statute required to focus on either adults with serious mental illness or youth with serious emotional disturbance. So the links here are particularly important. SAMHSA has an array of suicide prevention initiatives currently. So making sure that, at least with the initiatives that we currently have, that we are doing the best we can, that we are maximizing our efforts to prevent suicide is particularly important. These include support for the Zero Suicide Initiative. SAMHSA recently made 14 grants awards to states, healthcare systems, and tribes. We also have a significant youth suicide prevention initiative, the Garrett Lee Smith grants, that have gone at one time or another over the last 12 years to each of the 50 states. So the issue of identifying those who are at risk for suicide, who may also experience serious emotional disturbance, how best to intervene with them once they are engaged in the healthcare system, what are the best approaches to utilize, are vitally important issues for SAMHSA. So I'm very much looking forward to these next 2 days for the advice, guidance, wisdom, and discussion that I'm sure that all of you will provide. So again, thanks to all of you for being, both those who are in the room and those who are participating remotely. Thank you for engaging in this, and we look forward to ongoing interactions in our common obligations to do all that we can to reduce suicide in America. So thank you.